Cooley. It's the James Cooley Show. It's your life. Let's go. It's the James Cooley Show. It's your life. Doctor James JC Cooley. All right.
The James Cooley Show, It's Your Life, can be heard every Sunday at 9 p.m. right here on The Answer San Diego. Life is full of circles, cycles, phases, and stages. It's your choice to ignore or embrace them. Motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation, James Cooley, and his guest will inspire and equip you to strive for your own greatness and overcome adversities. Listen to The James Cooley Show, It's Your Life, every Sunday at 9 p.m. right here on The Answer San Diego.
The James Cooley Show, It's Your Life, can be heard every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth. Life is full of circles, cycles, phases, and stages. It's your choice to ignore them or embrace them. Motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation, James Cooley, and his guests will inspire and equip you to strive for your own greatness and overcome adversities. Listen to The James Cooley Show, It's Your Life, every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth.
Yeah. Dr. James J.C. Cooley. The James Cooley Show. It's your life. Yeah.
Hello, welcome to the James Cooley Show, It's Your Life. I'm your host, Dr. James J.C. Cooley, but as you already know, I'm not the real host today. But before we get all that started, I want Todd to lock in all the other platforms. Because we got Dr. Michael Mantell here. Todd, let's lock it in.
Are y'all ready for the show? Are y'all ready for the show? It's your life.
Hello.
J.C. Cooley. That's right.
Hello, welcome to the James Cooley Show, It's Your Life. I'm your host, Dr. James J.C. Cooley, and as you already know, it's 306-degree health. And, I mentioned 306-degree health. You know who the real host of that show is. It's none other than Dr. Michael Mantell. How are you doing today, sir?
Doing great, and I love the holiday theme. It's beautiful. I love it. It's terrific. We're in the middle of a beautiful season. Hanukkah, Christmas, Kwanzaa. Doesn't get better than this, does it?
It doesn't get better, and I think that we all need to come together and start enjoying these holidays. Learn how to love.
Love is what we need. The news is just filled with hate, and we're going to hear that. And we're going to talk about love, especially today in healthcare.
And that's what's important because the link is what you think. And you know what? We're gonna talk about that a little bit as well. But how you doing, Dr. Cooley? How are you doing today?
I'm doing great, James. How are you?
Well, I am so excited about today. Excited to have this great guest that Dr. Michael Mantell has brought to the show again. He always brings the best guests in the world, and so we got another one. And I tell you, it's so many things that we're going to talk about today. Just what Dr. Mike had just said about love, not hate. And I tell you, whichever platform that you're watching us on, whether it's E360 television, transfer TV, YouTube, LinkedIn, Twitter, Facebook, Rumble, and 84 other platforms, welcome to the show. Or if you listen to us on the radio, uh, all you have to do is just pick up the phone and dial 1-888-344-1170. And our producers in San Diego and my producers in Dallas will put you through. Michelle, can you do the honors by introducing the title of the show, purpose of the show, and introduce this absolutely wonderful guest?
Yes, well, it is 360-degree day, and we're talking about rebuilding the foundational architecture of healthcare. And we're having a sit-down conversation with Dr. Holland Haynie. He's a family physician, chief medical officer, and the founder of Rethinking Rural. He's going to discuss what's really going on in American healthcare, the gap between effort and outcome, from the exam room, what healthcare really feels like for the ordinary American, and why people fall through the cracks, and also rethinking rural and the human protocol. So again, Dr. Holland Haynie, he has spent more than 25 years practicing medicine in both rural and urban communities, focusing on the everyday challenges people face in staying healthy. He is the founder of Rethinking Rural, an initiative dedicated to rebuilding the foundational architecture of healthcare so care can stay connected, continuous, and human, especially in communities that struggle the most. He works with a small team of technologists and economists to bringing practical, people-centered innovation to American healthcare. Please welcome to the show for the very first time, Dr. Holland Haynie.
Thank you.
Hey, how you doing, Doctor?
I'm doing well, James. How are you doing today?
I'm doing absolutely wonderful. It's one of those days. Wake up and we still here, and we have a lot to be thankful for.
Agreed, especially this time of year. I love the introduction. Thank you so much for having me on. Really, really excited about this.
It's an absolute pleasure. I always ask the first question, and then I turn it over to Dr. Mike. Can you tell our viewers and our listeners a little bit more about you, where you grew up, what made you click, why you so passionate about what you do?
Sure. I born and raised in Georgia, small towns. I trained in family medicine, pediatrics. I've got 4 kids, 4 amazing kids, beautiful wife. She's my rock, Katie. But I've practiced in urban centers. I've practiced in academic centers. Spent most of my career though practicing in small town settings, like you all were talking about. I work now in Missouri, family medicine. I see patients 4 days a week. Family medicine's always drawn me because it's more than just the medicine. I enjoy the relationships. It's getting to know people. A lot of my patients, I'll take care of the whole family. You get to know them. You get to know their struggles. You get to know their stressors, their jobs, you name it. So it's a huge responsibility. It's humbling. I'm grateful every day I go to work that people trust me to involve me in their lives, to let me help them through some of the hardest things they go through. So it's such an honor to be able to step into the rooms and have people see their problems and to work through it with them and meet them where they are.
Dr. Haynie, it's just a real privilege that you've taken time out from your busy day, away from your patients and your beautiful family, to spend some time with us, educating us. I just want you to know how much I appreciate this.
Well, I appreciate you having me.
You said we don't have a shortage of talent in healthcare. We have a shortage of connection or even compassion, love,
Sure.
if you will. What does that look like in real time when a patient and doctor are right in front of each other?
I think that's exactly it. Our country has the world-class providers. We have world-class training centers. I don't think we have a shortage of training of solutions in this country. It's the connection is, in my opinion, the hardest part. It's those fragments of people's lives, the moments that happen between the visits. I think that's a lot of the challenge that I have, that my staff has, that providers across the country run into, that we have the moments of care when they come to the clinic. We have the moments when things fall apart, but so much of life happens in between those. And I think that's what I call the fragments of care that we're really trying to string together. And I work real hard to glue those together, as do most folks in healthcare these days. But that's one of the bigger challenges, I think. As you say, to what goes on in the rooms, I think people would be surprised how much work we do to piece all of that together. When folks come to see me, so much of the encounter is, have you filled your prescription? We repeat the same questions, and at the end of the day, I think it's because we have a memory problem in healthcare. I don't think it's technology. I don't think it's training. I think as soon as patients leave the room, the system forgets.
You use the term provider, and for many, many, many years, I have been rambling about the fact that when physicians and healthcare professionals became providers, it began to go downhill. When we started talking about the healthcare industry, it went downhill. And you talk about people falling through the cracks.
Yeah.
What are the invisible cracks that the public would be shocked to learn about when we think about the public falling through these cracks?
Yeah, I think at a high level, those cracks you're talking about, the invisible cracks, are the gaps between what is supposed to happen and what actually happens. And that's an area that we have very little visibility into. For example, someone I see in clinic and provide them a prescription for a blood pressure medication. Myself, the system assumes that prescription is going to get filled. And unfortunately, unless they return to the clinic a few months later and things are going well, or worst case, they end up in an emergency room when things aren't going well, those cracks are what I think we're challenged with these days, is understanding why things don't happen, understanding the things outside of medicine. I think patients' intentions are more often than not extremely good. The system sees it as non-compliance. Right.
Yeah.
Someone doesn't pick up a medication, they come back, their blood pressure is still high. The system tags that as non-compliance. I don't think that's the case. I think oftentimes these decisions that people are making are not around medical issues. They're around issues at the kitchen table, issues around their checking account, issues around when is payday, when, how do I put gas in my car? Do I miss a shift to go to a follow-up appointment? How do I pay for childcare? And those are the things we really struggle with, that my staff, that people across the country, I think, struggle with putting those pieces together and understanding that full picture of a patient, which is why I said before, I think it's gluing all of those fragments of life together into a continuous story that we're really most challenged with.
Sometimes it's about emotional anxiety, fear. Last week we had Dr. Manju Dawkins on, and her Thimble program talking about fear of pain. I had to have a simple procedure done, having wax removed from my ear. Dr. Cooley is going to be here in just a moment, but just real quickly. And I said, oh my God, that's going to hurt. I better find the best expert 6 weeks away. And a friend of mine said, a medical student can do that for you. I said, I know, but I don't want it to hurt. And this woman's known for that. So sometimes it's not anything more than just emotional concern, even amongst professionals.
Yeah, it's super true. Super true. It's that humanity, that touch. Those are the things that I think make medicine worth it to me.
Right.
Wow. You know what? This is so absolutely fantastic already. We're going to take a station break. But I tell you, you want to be part of this great conversation with Dr. Haynie, and also my main man, Dr. Michael Mantell. All you have to do is a couple of ways. You can go to the platform that you're watching us on. Go to the chat, ask any question that you might have. I promise you we'll get you an answer. Or you can pick up that phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and we'll see you shortly after the break.
That's right. 1, 2, 1, 2. It's your life with Dr. James JC Cooley. Yeah. All right. Your life with Dr. James JC Cooley.
Christmas lights are all around. I can see them now. It's like they spell your name. It's insane. Now we're back here once again. Holidays and cheer. But now I got my eye set on you. I'm not gonna play it safe. It's going down on Christmas Day. 'Cause I've been trying to tell you in every way. Yeah, I've been trying to show you, but somehow failed. I wanna have someone to hold. Walking through
Are y'all ready for the Dr. James JC Cooley Show? It's your life.
Hello. Welcome back to the James Cooley Show. It's your life, and the link is what you think with Dr. Michael Mantell has done it again, has brought another absolutely first class doctor on the show. And today, if you're just not tuning into the show, what we're talking about, rebuilding the functionality, architecture of healthcare. As you know, it needs to be rebuilt with so many issues and concerns and problems, especially in mental health. So we got one of the best, Dr. Holland, is talking about a lot of these things. And I tell you what, if you want to be part of this great conversation, all you have to do is go to the platform that you're watching us on, ask any questions in the chat portion of it that you might have. I promise you we'll get you an answer. Or you can pick up that phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. Back to you, Dr. Mike.
All righty, James. Thank you very much. We have a wonderful guest here. In our first segment, we've already unpacked so much interesting information. So, Holland, Dr. Haynie, so many people I know turn to one of the chat GPT, AI, sources and ask it all kinds of questions about their medical issues. Many of the people I see say, hey, Dr. Mantell, I checked with chat GPT, and this is what they say. I'm curious about your take on using AI in healthcare. What's the risk of layering this advanced technology onto what we're identifying as sort of a fragile patient care foundation. What are you thinking about AI these days?
I think the potential's enormous. I mean, I think we're already seeing it help with efficiency, help with more accurate documentation. Hopefully we get it to recognize signals a little bit sooner. But like we were talking about before, the fragments of healthcare and the foundation and the lack of memory in the system, I think the concern I have is it kind of goes back to that old saying, garbage in, garbage out for computers, right? Back to IBM in the 80s. And I think that's even more true now with AI. AI is only as good as the information that we provide it to make decisions or make recommendations. So, and unless we work on this foundation that we're talking about, the architecture, the underlying plumbing for healthcare in this country that remembers patients, that's capable of telling the full patient story, and providing that type of foundational information to AI, then AI is going to only have fragments of care. It's only going to have the snapshots of information. It's going to hallucinate. It's going to drift. The information's not going to be accurate. So my concern, or I guess my optimism, is that if we work now to reestablish that foundation, to address the architecture issue that JC was just talking about, that we can get this right. AI has so much potential, but at the end of the day, I think we need AI doing the chores and leave the caring up to the humans. So that's what I'm hoping we can get to.
A colleague of mine, in the intake information that he has patients fill out, asks, have you looked at AI to investigate your condition? If so, what have you found? And what he tells me is that patients really appreciate the fact that the doctor is not afraid of AI or turning away from it, but is using it to help him connect better with what the patient's concerns are. What do you think about that?
Well, I think it's inevitable. I think it's there. People now, almost daily, folks come in and say, I Googled this, or I chat GPT'd this. And I think it's terrific. I think if we, like I said, I think if we can get to a point where we're making sure the information that we're giving AI, the large language models that AI is built on, at the end of the day, are only as ethical or knowledgeable as the people that design the rubrics that generate the output.
Right.
So I keep coming back to, we have to work on the foundation to give AI the right information to make the decisions. But I engage people with it. I think people are going to use it. So there's no fear there. But it does make for some interesting conversations when folks come in with a differential diagnosis that Chat GPT spit out. So we do have some funny conversations sometimes.
I think it builds a real human connection. It's like we're both aware of this and we're both using this. Let's not be afraid of it. I don't have to be the expert. We can all gain information.
Yeah.
So from the exam room, let's look at what healthcare looks like for the ordinary person. You practice in both the inner city and rural settings. I'm interested, what surprises you most about how similar the challenges that people face in these environments actually are?
I think that's just it. I think that the similarities are way more significant than the differences. And perhaps in rural, the distances are longer that people have to travel. I think there may be more gravel roads, but in the city, perhaps there are a larger concentration of physicians, of healthcare workers, of university centers of technology. But outside of that, the people themselves, people rural, people urban, people's problems are strong enough, heavy enough to bend steel. And I've seen that every place I've worked. So at the end of the day, I think our problems are way more similar than different. Geography doesn't have any bearing on that.
Yeah, so with the foundation as it currently exists in healthcare, what are some of the biggest challenges, and why are so many folks not receiving and understanding their health and the knowledge to prevent certain problems and issues because of their socioeconomic status or wherever that might be?
Well, I think it goes back to where we started with the memory issue. To me, that's the biggest issue we have in healthcare. It's not about interoperability or technology or solutions. Like I said, the system, if you will, forgets the patient when they leave the room. So our work doesn't add up. The work that the patients do, we don't see that compounding over time. Patients see it doing the same clipboard every time they come to the clinic, answering the same questions. As we talked about, myself, my staff, folks in healthcare across the country are spending just heroic amounts of time behind the scenes to piece together things that have already happened. Was a prescription picked up? And it's a manual process. So I think that's one of the bigger challenges for patients and providers, is that the system forgets. So our work's not adding up over time. It makes it a chore.
As a physician, can you take us to a typical day in the exam room where what surprises people and patients the most about the care of a particular doctor? I'm talking about it. We all got our own personalities. We all got this, but I think the goal is to ensure that the patient knows that we care, and that they, at that moment, during that 15 minutes or whatever that is, that they are the most important thing at that moment. How can doctors help make patients feel that way, and where they can understand that they care?
To me, it's meeting people where they're at. To me, it's that there's no one size fits all. And that we could extend that into the conversation about AI and technology, trying to force things, rubrics and protocols. But at the end of the day, every patient's different. Every situation's different. Just because the care metrics or the clinical quality measures say that someone should be doing something, a lot of people are very happy in their lifestyle. And so to me, it really comes down to understanding what goals the individuals have. I think that's real important. And then me to jump in and to help to try to meet them where they're at. Because every single patient's different, their goals are different, their lifestyle is different, and attempting to force square pegs into round holes is never going to work.
You've said, I think very wisely, that continuity is the real lifesaver, that health happens between appointments.
So,
what do we consistently miss in those in-between spaces?
I think we miss the small moments. I think we miss the things outside of healthcare. I think we miss the effort that patients put in, the hurdles they have to get over to come to follow-up appointments. I think we miss the issues that prevent them from coming to appointments. I think currently our system, the foundation that we have, is a sick care system. It was designed that way initially. You and I were talking about this before the show. I think 150 years ago, we built emergency rooms and hospitals to take care of people when they're sick, when they have infections, when they fell off of wagons. And now we've moved upstream. We're attempting to get ahead of this, to do chronic condition management. And the floor simply won't hold. And I think that's a significant challenge, because AI is not the magic. It's the continuity. It's the work ahead of us is to figure out how to glue all these fragments together, the small things that prevent people from picking up their prescriptions, the decisions, like I said, that are made around the checkbook ledger, or made around the kitchen table, or made around life, and not simply tagging that as non-compliance. We've got to find a better way to fill those gaps and to address the solvency issue, quite frankly.
So when you say we have to find a better way, what about something simple as a note, an email from the doctor's office? Hey, just checking in to see how you're doing. Have you had a chance to pick up your medication? Any questions you might have, I'm here to answer for you. When I share that with my friends who are physicians, they look at me in horror. What do you think about that?
I think it's how we're doing it now. I think some of the hardest work that's going on behind the scenes are the folks in that care coordination, the chronic condition management, and it's a manual process. And it is just that. It's sticky notes. It's retrospective chart review. It's phone calls. It's trying to get in touch with the patient to see if prescriptions were filled up. But it's also a bandwidth issue. One care.
Hey, Mark, I'm gonna have to cut you off real quickly. We got to take a station break. This is so great. Dr. Mike, please ask that question when we get back. I tell you what, I'm enjoying this great company. conversation and discussion that we have. If you want to be part of this great conversation, this is the platform to start this time. Ask any question that you might have. Also, put the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170.
At Viridian Christian
Your
University,
life.
we believe education is more than just a degree. It's a pathway to a purpose-driven life. Whether you're advancing your career, pursuing a passion, or building a new future, VCU's 100% online programs give you the flexibility to learn on your terms, anywhere, anytime. With expert faculty, personalized mentorship, and a faith-centered approach, you'll gain the skills, knowledge, and leadership you need to make a lasting impact. VCU offers bachelor's, master's, and doctorate degrees, each designed to empower you for success in today's fast-changing world. Join a global community of believers, learners, and leaders. Ready to start your journey? Viridian Christian University, transforming lives, empowering futures. Visit us at viridianchristianuniversity.com.
Country boy.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? In everything that you do.
I'm Dr. Michelle Cooley. Heart disease research saves lives. It's that simple. Thanks to medical advancements funded by the American Heart Association, more women are surviving heart attacks, strokes, and other cardiovascular diseases than ever before. But there's still so much work to do.
Hi, I'm Dr. James J.C. Cooley, and I'm raising funds to support life-saving research because every heartbeat is worth fighting for. In honor of Women's History Month, please join me in support of the American Heart Association and women's health.
It's your life with Dr. James J.C. Cooley.
Hello. Welcome back to the James Cooley Show. Welcome back to the James Cooley Show. It's life. As you already know, 306-degree health. The link is what you think. We're going to slide that in right now. But I tell you, this discussion that we are having with Dr. Holland Haynie and Dr. Michael Mantell, I mean, it's so needed in a lot of different ways because not only the functionality of our healthcare system need to be restructured, but patients need to understand that they are important. And through the reduction of a lot of things, through AI, through a lot of things, that gives them a lot more knowledge, not just from the patient to the doctor to patient, but doctor to doctor as well, because burnout is a big issue as well. So we're going to talk about that a little bit later. But as you know, our segment, the link is what you think. Dr. Michael Mantell, what do you have for us today?
Well, here's the book. The link is what you think. There it is. And as you know, I wrote that book and the original Don't Sweat the Small Stuff. And is aimed at helping people live better and disturbing themselves less about what goes on in the world. And I want to offer 5 things to consider to help you tackle today's life's issues. I opened to page 272. And again, I don't believe in coincidences, but this is called Be Kind. And boy, do we need that more than ever. This is total coincidence. The 5 points. Number one, who really needs a reason to be kind to anyone anymore? Number two, kindness is probably the best religion to follow. Number three, looking for a really special gift, give kindness. Not only will it lift someone else, but it will lift you too. In my talking with Dr. Apurv Gupta, who's been a guest on our show and has a loving organization, I shared that I define love as lift others, value everyone. Number four, more and less. Guess which? Kindness, hurry, laughter, and worry. That's what we need more of or less of. Decide. Number five, when you give with authentic kindness, you don't count the cost. You just give from your heart. So there is the book. Remember, the real link is what you think. And if you heard one nugget in amongst the five, then my goal has been accomplished. The link is what you think. I want you to understand how important it is to stay kind, stay curious, and don't sweat the small stuff.
That was so great. That's outstanding. I see that we got folks over in Africa and Ghana.
Wow.
Sent me a shout out. Told me, good evening, Your Royal Highness. I like your dance. Well, I'm going to continue to dance. I love dancing. I love showing enthusiasm. I love happiness. But I want to get back to you, Dr. Mike. Can you please re-ask that question again?
I wish I could remember the question.
Dr. Holland, do you?
we were talking about the importance of care, I guess, and I honestly do not recall the specific question anymore. But Dr. Holland, if you do, please go with it.
No, I think we were talking about the gaps in care, the continuity. We touched on how similar things are, but I think I keep coming back to the issue that we don't see the full story. I think for me to be able to truly care, to touch on the topic here, it requires understanding the whole person, right? Not just their labs, not just their vital signs, but the whole story, and even those small moments that are happening in between. And how do we do that with proof? How do we do that with receipts that I can bank on, that I can have the clinical courage or the clinical confidence to make decisions? And I think that's the work ahead of us here.
And specifically, we're talking about the space between appointments where real care, where real health takes place. So I want to just turn to now. You've used something called a train analogy, in your writings that I've seen that you put out. We build gorgeous trains, but we forget to build the tracks. Mm-hmm. What is the track in healthcare, and why didn't we build it?
Well, I think of the trains as, we're all on a journey in our lives and in healthcare. I think we could look at the trains as being the physicians we see, the hospitals, the clinics we visit, even the technology that we interact with. And we have great trains. We have powerful locomotives. But it goes back to what I said earlier, that our system was designed for sick care initially. It's no one's fault. It's just the infrastructure was designed as a safety net system when people get sick to go to the emergency room. And now that we've come so much further and healthcare has evolved and we're working so hard to get ahead of things, to get upstream, we've got to foundationally look at this differently. So the tracks aren't there. The trains, people jump different trains run in different directions. Trains, we don't know when to expect people. By putting tracks in place to understand where people have been, what their full story, linearly, fragments together, and also where they're going, where to expect them, so that we know when they don't arrive, that we could intervene. Nowadays, I find out when trains go off cliffs, and I think and the analogy is ideally to bring attention to the fact that it's a fundamental architecture issue, that it's a foundation issue. It's not a solution. AI is not the magic; it's continuity. And to do that, it's a structural issue so that we can track people, and not in a surveillance in a creepy way, in a way that they own that themselves. I think that's the challenge here, is to make sure people feel comfortable with the data they're sharing.
How do you, go ahead. I'm sorry.
It was a video I meant to show earlier. It's just 30 seconds, but I think this is a good time to do this, and Dr. Holland, if you can explain afterwards.
Rural healthcare isn't one story. It's 1,000 squares of a life. Kitchen tables, blood pressure checks, school gyms, waiting rooms. The work is real. The effort is real. But the seams between them have always been left to chance. This is what we're building now. A new rail that connects every human moment into one continuous line of truth. Not another app, a foundation, a stitch that finally holds.
Wow. No. That draws the picture of rethinking healthcare. And I didn't mean to interrupt Dr. Mike, but I wanted to get that in there so the great Dr. Holland can explain that drawing.
I think those are the fragments. Talk about the system not remembering, and I think, and the other big issue is the continuity. We don't have the glue in place. And another analogy I think that drives it home is in our country, we have a financial system that if you take money out of an account, if you deposit money in an account, if you go to ATMs in different states, we trust it. It's verifiable. The receipts are there. The continuity is there. We don't question it. Nothing even similar to that exists in healthcare. And I think that's really what we need to be able to have the confidence to make decisions, that I can look at information. I can know that it's real. I can see the receipts for what happened. I can understand a full patient story. And then we finally glue all of those fragments together. So that's the quilt analogy in the video there. Just we've got to find a way to stitch all the pieces of an individual's life together, all the things that are affecting outcomes. And it's not just medical. It's checking accounts, all the other things that people manage in their day-to-day lives that ultimately do affect outcomes. And that's the goal here.
So how do you think a patient knows that you care? They come in with that chronic cough we were talking about that everyone seems to have lately. There's this fall virus, whatever it may be. How do you think a patient knows you care about them as a human being as opposed to their cough?
Well, I think one's the memory issue. Well, we were talking about the system doesn't remember. I think when you remember the small details, when you get to know them, when folks come in and you're not just jumping straight to the diagnoses. The diagnosis isn't the humanity of it. I think the humanity in healthcare are the eye contact, the noticing of the pauses, the asking of questions that patients they may be afraid to answer. So I think one is staying human in that encounter, and also just remembering, and it's not just about the diagnoses, the vital signs, the medications. It's understanding their life. It's meeting them where they are. I think that makes a huge difference. Folks want to be known by not just their providers, but by the system itself. So I think that you could easily draw some lines there as well.
We have a minute left, and I suspect that James is going to come on and tell us that in a moment. So I'm going to wait for him to come on, because I have another question about what the staff in your office is directed to do to help patients feel cared for. But JC, tell us, we have 45 seconds left.
Well, actually, I think, and we're going to remember this question this time. We're going to take a station break right now, and we're going to come back, and we're going to get off into a lot of these things. And I got a surprise when we get back. And I'll tell you what, if you want to be part of a great conversation and with the surprise, all you have to do is just stay tuned. Ask any question that you might have. I promise you will get you an answer, because it's your life, and we'll see you shortly after the break.
There's much truth in a journey that ain't.
Hey, it's your life with Dr. James J.C. Cooley. That's right. It's Dr. James J.C. Cooley. It's your life show. Dr. James J.C. Cooley.
Rural healthcare isn't one story. It's 1,000 squares of a life. Kitchen tables, blood pressure checks, school gyms, waiting rooms. The work is real. The effort is real. But the seams between them have always been left to chance. This is what we're building now. A new rail that connects every human moment into one continuous line of truth. Not another app, a foundation, a stitch that finally holds.
Is a nonprofit organization that was
The James Cooley Show. It's your life. That's right. That's right. Are y'all ready? It's Dr. James J.C. Cooley. It's your life. That's right. Dr. James J.C. Cooley. It's your life. That's right.
Hello, welcome back to the James Cooley Show. It's your life, and a couple of things that we're gonna get out during this segment. First of all, it's official, and His Royal Highness, my King, which I'm one of the sub-kings of our great kingdom over in Ghana. Our kingdom is called Agona Sarkaran. It's official that my beautiful wife, Michelle Cooley, will be crowned Queen, Mother of my kingdom, February the 4th, over in Ghana. And I am so excited to share that official word just came out. And I see that we got King Nana Otu, my great friend, on the show, along with a lot of the other kings that's in Ghana watching the show. And I was told that I can make that official. And so, 14th February, it's going to be live, televised. If people want to watch that, I will send you the link where you can watch it live and wherever you're at in the world. So that was one of the announcements I wanted to make. Second announcement, Dr. Haynie, I don't know if your schedule allow you to come back on the show for part 2, but Dr. Michael Mantell and I would love to host you on the show again in part 2, because we're not going to finish everything that we got to in the last 8 minutes. I see what my producers are telling me. So if you have time in your schedule, Dr. Mike, is that okay?
Not as okay, but I was wondering when you were going to ask the key question. We want you back again, Dr.
It would be my pleasure. This is so much fun.
Great. You're talking about something that's so important to the average person walking into a doctor's office. From the time we make the phone call to make the appointment, what do we hear? Okay, the doctor can't see you for 6 weeks. He can get you in. Okay, anything else? Bye-bye. Or, Dr. Haynie is a fabulous doctor. You're going to love seeing. I mean, this is exactly the question that I wanted to ask when we cut for the break. What can the front office do to help a patient feel care coming from this office, not just simply treated?
I think you just named it. I think it is just the difference in the way you talk to people, and remembering the smaller things. Folks that have transportation challenges. Even to me, when I'm a patient or anyone, you want to be remembered. You don't want to feel like a number. You don't want to feel like you're rolling through a machine. And that takes those. Sometimes it's just slowing down a little bit. It's not always necessary. I mean, we do our best to remember. Folks want you to know their story, but sometimes it's just the smaller things. It's taking a minute to, how are you doing? Talking about the weather, just the smaller human touches make a huge difference. Even smiles. I think that we overlook the smaller nuances of being human sometimes, and that's what keeps us all connected. So I think that's a huge piece of it, is treating people like they're human, listening, and doing our best to remember.
What gives you hope that American healthcare can finally align effort with outcome?
I think we're at an interesting place. I think that to get the system to remember and to really address the continuity issue, a lot of people have been saying for a while, but I think finally, for the first time in my career, I'm hearing providers, I'm hearing politicians, I'm hearing payers, I'm hearing everyone across the industry, technologists. We're all singing the same song. We're all looking at this through the same lens. We're all on the same page, singing the same hymn in the same key finally. So I think that gives me a lot of optimism that the country's finally ready to do this, that people are rowing in the same direction, and we got a chance to get this right. So I am very optimistic that the time is now, and everyone's leaning in the same direction.
And as we both know, Dr. Apurv Gupta's A Loving Organization is bringing that love and compassion and connection to healthcare and to other places, universities, and so forth as well.
Sure.
This is so important. People want to be cared for, not just treated.
Correct.
Treatment is important, but one wants to have someone put their arm on your shoulder and say, "It's going to be okay. We're here for you. We're going to take care of you. Take care of you." What's the next breakthrough, Dr. Haynie, technological or human, that you believe can change things dramatically?
I think, I keep talking about the memory issue, but if we find a way for the system to not forget the patients when they leave the room, and we find a way to tell the full patient story, not just the medical story, but the whole story in a way that the patients feel comfortable sharing their information, that even patients own their own information. And that information is leveraged by AI to pick up symptoms before they cause major problems, to pick up people when they're disengaging before they disappear. I think the next big breakthrough is going back to the human side of medicine and telling the full patient story and having the system not forget.
And if people want to be in touch with you, Dr. Haynie, how can they reach you?
They can email me, holland@rethinkingrural.com. Or they can go to the website. There's some links on the website, rethinkingrural.com. We need everyone involved. This is a group effort. It's a big undertaking, and I think we've got a chance to get this right. So I'm very optimistic, but would love to hear from folks that want to get involved.
Thank you for your leadership. Thank you very much.
Yes, okay, thank you for having me on.
Hey, Dr. Holland, 1 minute closing remarks. What do you want our viewers and our listeners to take from this absolutely fantastic, great discussion?
I want them to not be afraid of the future. I don't want them to be afraid of technology. I think everyone sees what we need to do here. Everyone realizes the work ahead of us. I think we've got to keep the humanity in medicine and we're going to accomplish that. So I don't want people to be afraid of the future. We're going to get this right.
I want to thank you so much for taking the time. Looking forward to having you back on the show again. I like to thank Dr. Mantell Cooley for putting together another absolutely fantastic. I like to thank my partner, Dr. Mantell, for bringing all these great guests on the show. I like to thank my producers back in San Diego and also in Dallas. Most importantly, I like to thank you, the viewers, for tuning into the James Cooley Show. It's your life, Monday through Friday, 2 p.m. Pacific Standard Time, 4 p.m. Central Standard Time, 5 p.m. Eastern Standard Time. Always dream big, think big, and be big. We'll be back tomorrow, same time, same place. It's your life, and we'll see you then. Dr. Holland, absolutely fantastic show, my friend.
Yeah, I couldn't have enjoyed it more. Your energy is amazing. It is contagious. I love it. I really appreciate the opportunity, and I would be more than flattered at any point to come back on and speak with you. This was really a joy.
We would love to get you back on. The information that you shared with our audience, our viewers. I mean, you don't see the numbers, but I do. They was highly engaged on all platforms.
Wow.
So thank you. I would love to have you back on if your schedule permit.
Absolutely. You just let me know. I will carve out the time, and in the meantime, I'll be watching. You got a new viewer.
Hey, thank you so much. Thank
Yes,
you
sir.
so much. Thank you so much. And I'm wishing you and your family Merry Christmas and Happy Holidays.
You too.
Thank you,
Thank you so much, yes, sir. You have a great evening.
Thank you.
All right. Bye-bye.